Welcome everyone, my name is Melinda Antal, and in my thesis I would like to discuss the optical and mechanical properties of dental ceramics. I'm a fifth-year dental student and a first-year PhD student at Semmelweis University. My vision is to provide patients the best all-ceramic restoration, and my mission in this would be to supply dentists a guidance about the appliance of different dental ceramics. I have two specific goals for now, which are strongly connected to each other, since both of them investigate a dental ceramic called zirconium dioxide, or shortly zirconia. In my first project, I would like to compare the mechanical properties of additively versus subtractively manufactured dental ceramics with the method of a systematic review and meta-analysis. Over the past 35 years, CAD/CAM has become an increasingly useful technology in dentistry. It basically allows you to produce all ceramic restorations, even in your own dental office. When talking about this, the manufacturing is mostly milling, which has some big flaws, like wasting a lot of raw material that can't be recycled and causing the wear of the milling too, so overall, this is expensive. Recently, a new method, printing, has emerged in literature. As you may know, printing is the method of building objects layer upon layer. There are many available techniques, but the two most important ones are SLA and DLP, both based on photopolymerization. Printing has big potential because it could overcome the disadvantages of milling, like not wasting as much material and being quicker, so it is overall a more cost and time effective method. Just to highlight this with an example, from the material price of 1 milled crown, we could get even more than 30 printed crowns. As we see, printing has big potential, but mechanical properties are the most important when a new material is introduced. When we want to see if printed materials could overcome milled materials, we have to be sure that they are at least as strong as milled materials. And the most important to evaluate would be flexural strength, since it helps to predict the performance of a restoration. This is why my aim would be comparing the mechanical properties of additively versus subtractively manufactured dental ceramics. This leads me to my clinical question: do mechanical properties of dental ceramics differ when produced with additive versus subtractive CAD/CAM manufacturing? My population is zirconia. I would like to compare additive to subtractive manufacturing. My primary outcome is flexural strength, and my additional outcomes are Vickers microhardness and weighball characteristics. I hypothesize that additively and subtractively manufactured dental ceramics have similar mechanical properties. Here you can see the details of my systematic search that I conducted in 4 databases, and after the selection process, I ended up with 115 included articles. Here I listed my finished and ongoing project. On the upcoming slides, I would like to show you my results for 3-point bending strength. 3-point bending strength is flexural strength measured with 3-point bending test. As I said, flexural strength is really important for a dentist since it helps to predict the performance of a restoration. The measuring unit is megapascals, and for dental zirconia, it's above 800 megapascals. Here you can see the results regarding 2 armed studies. We included 8 in vitro articles that had the same weight on the outcome. You can't unsee the big heterogeneity, which is due to the fact that these articles use different bands of zirconia, different printing technique, as you can see in the comment section, and different specimen dimensions. Our outcome was mean difference, and if the article is on your right, then the milled material was stronger, and if the article is on your left, then the printed material was stronger. We had an overall mean difference of over 180 megapascals, which is, although clinically relevant, it hasn't reached mathematical significance, suggesting that printed and milled zirconia have similar mechanical properties. But although printed materials have come a long way and are really close to milled materials, we still think that there's room for improvement and they can be used in the same indications. We also examined 1-arm studies. Here, instead of mean difference, we are working with pooled means. We did subgroup analysis based on the yttria content of zirconia. Zirconia usually has 3 to 5% yttria, and to put it simple, the higher the yttria content, the better the aesthetics, but the weaker the material. Looking at each subgroup, we can recognize the recently mentioned pattern. In the 3% group, the overall flexural strength is above 850 megapascals. With 4% yttria content, it is only 680 megapascals, and with 5% yttria, it decreased to 470. Looking at printed zirconia, we have similar results, with the only difference that there's no 4% yttria stabilized zirconia available to additive manufacturing. So with 3% yttria content, we have a flexural strength over 800 megapascals, just like in the milled group. And with 5% yttria content, we have 646 megapascals. Which is really interesting is when we look at the printed group, the 5% yttria stabilized zirconia has similar flexural strength as the 4% yttria stabilized zirconia in the milled group, meaning that with using printed 5% yttria stabilized zirconia, we can get really good aesthetical results without compromising for lower flexural strength. Still looking at the printed zirconia, we did subgroup analysis based on the printing method as well. I would like to highlight the results for SLA and DLP being the most popular printing techniques. For direct light processing, we can see that we have an overall flexural strength of 553 megapascals, and with stellar lithography, it is above 850 megapascals, meaning that DLP-produced zirconia cannot be in the same indications as SLA-produced zirconia, and that SLA has a really big potential, giving us printed zirconia with a high flexural strength. Our included studies had the strength of measuring in a standardized way and exploring all methods for flexural strength testing, and we included many one-armed articles instead of the two, next to the two-armed articles, but these articles used different brands of zirconia, different manufacturing techniques, and different specimen dimensions. Overall, we can conclude that printed zirconia did not overcome milled zirconia yet, and that printed zirconia is better as a temporary solution. It can be used in the same indication, and that there's a need for further investigation regarding the sterile lithography printing technique. This is my progress regarding my first project, and allow me to move on to my second topic, which investigates the effect of material aging on the color stability of dental ceramics. As I said, with the introduction of improved materials and fabrication technique, we changed the aesthetic restorative treatment patterns, and this resulted in a higher demand for aesthetics in dentistry. This led to the worldwide spreading of all ceramic restorations, which can successfully mimic dental structures. Zirconia is one amongst the most popular dental ceramics. It has excellent mechanical properties, so it can be used for restoring molars, and with the introduction of more translucent versions, it can be applied in the anterior region as well. But whenever we place zirconia into the harsh environment of the oral cavity, it ages just like every other dental material, and aging can affect color. And since patients care mostly about appearance, color stability is a crucial factor throughout the functional lifetime of a restoration. This leads me to my clinical aim, to investigate the color stability of dental zirconia. We worked with the PICO framework again. In our clinical question, we asked, does aging of dental zirconia affect its color stability in vitro? Our population is dental zirconia again. We would like to compare thermocycling, investigate thermocycling, mechanical and chemical aging. We would like to compare it to the material before aging, and our outcome would be color difference. We hypothesized that the aging of dental zirconia does not affect its color stability in vitro. Our implication is really simple: to provide patients long-term aesthetical restorations. Here you can see the summary of my two ongoing projects investigating the mechanical and optical properties of dental zirconia. And I would like to thank you for your attention with my favorite quote from opera: failure is a great teacher, and if you are open to it, every mistake has a lesson to offer. Thank you so much.
I think I remember from your first topic, from the first outcome, that you have the 3-point strength. You mentioned in the group meetings about the issue that you had with the Rivoli-Lyon, I think, paper, which you have quite opposite results, just with 1 year difference.
Yes.
Can you tell us a bit more about this? What do you plan to do? Did you have any answer from the authors? Do you plan to still include those two papers? What do you think about this?
So I still included these two studies in my analysis. So basically what we what came clear is that the second article used a standardized way of measuring, which gives opportunities to get higher flexural strength. And also they used material from a certain company that prints zirconia for a really long time now, and they used their own printer from this company, which is compatible with this material. So overall, you can get really good flexural strength using this technology. Still, it's for me, I think this flexural strength is still too high. That's why I contacted the author. Still no answer, but I'm attacking on many platforms, so let's hope. And we are planning to do maybe a leave one out analysis as well as a sensitivity analysis to see what we can do with this one.
What is missing for dentists is apply the printed techniques in Europe, really apply the techniques in Europe?
Maybe I would say that there aren't maybe many printers available here, and as far as I know, they have to be approved, and this is a long journey, and maybe this is why printing zirconia is still not available in Hungary. But we also have some printers at the university, and we can print dental polymers. So we are exploring printing, but we are at the very beginning now. But I hope that dental zirconia will enter our gates too. Thank you for your question.
I've seen in the forest plots that you have many articles on the same year from the same author.
Yes.
So you, how do you analyze these results? So how come that they are the same author, same year? They are different articles, same articles. How is it going?
Thank you for your question. These articles are usually from the same author, so these are the same articles, but they included more brands of zirconia in their study or different building orientations regarding printing. We actually are planning a subgroup analysis based on printing direction because it can influence flexural strength. So this was just a preliminary plot, and we plan to add a comment section explaining that what are the differences between these articles. Thank you.